So taking Tylenol is not good. All right, I'll say it. It's not good. During pregnancy can be associated with a very increased risk of autism.
What Mr. Trump said. So I don't see any scientific evidence behind what he said.
Someone who's a mother right now and is watching this video, should she be worried right now about having paracetamol if she's having a mild headache?
In so many years of practice, in so many research papers, whether it be by the American College of Obs and Gynae, the Royal College of Obstetrics and Gynae from London, or the Indian Medical Association, none of them have condemned the use of paracetamol in pregnancy. It has been one of the first preferred drugs and the safest drugs that we recommend for pain relief and for fever in pregnancy.
There are certain maternal infections or there are certain conditions which have been associated with autism, but there's no direct cause-effect relationship when it comes to paracetamol and autism.
Hello and welcome to the Indian Express. I'm Charulata Biswas. US President Donald Trump's recent remarks on paracetamol, commonly sold as Tylenol in the US, have once again sparked controversy. Trump claimed that taking paracetamol during pregnancy could increase the risk of giving birth to children with autism, suggesting that all pregnant women should limit its use and consult their doctors. Now, WHO has called this claim unscientific, stating that the evidence linking paracetamol use in pregnancy to autism remains inconsistent. Now, today in my discussion, I'm being joined by Dr. Astik Joshi, who is child psychiatrist at Fortis Healthcare, and Dr. Manan, who is a gynecologist, and he's practicing out of Delhi. Thank you so much, Astik, Dr. Astik and Dr. Manan. How are you guys doing?
Good. Thank you so much for having us here.
Thank you so
Very
much.
well, thank you.
Dr. Manan, let me first begin by asking you your first reaction to what Donald Trump said, and can you explain if pregnant women can indeed take paracetamol?
So paracetamol has been used since time immemorial in treating so many conditions in pregnancy, from simple things like a headache to gastric ache to fevers to flus to all kinds of pain. We have been using paracetamol, and in so many years of practice, in so many research papers, whether it be by the American College of Obs and Gynae, the Royal College of Obstetrics and Gynae from London, or the Indian Medical Association, none of them have condemned the use of paracetamol in pregnancy. It has been one of the first preferred drugs and the safest drugs that we recommend for pain relief and for fever in pregnancy. Now, going to what Mr. Trump said, so I don't see any scientific evidence behind what he said, and from the outside it seems more of a financial issue, because Tylenol is produced in huge numbers and brings in a lot of revenue to the American government, and he might not like that revenue affecting the American economy. So I think it has nothing to do with autism in children, and we have no evidence whether it is current or in the past, neither in America or anywhere else in the world, where paracetamol has been known to cause autism. So yes, of course, long-term use over a prolonged period of time, say over 5 years, can lead to neurodevelopmental delay and attention deficit syndrome in certain patients. But short-term exposure for 9 months, even in a high dose, does not pose any risk.
Could you tell me and the viewers, why is it the first choice of medication for mild pain or, like you said, fever in expectant mothers compared to other drugs that may have more risks?
See, paracetamol belongs to a family of drugs which is called NSAIDs. So painkillers are broadly either morphine based or non-morphine based. So we cannot give morphine based drugs in pregnancy because they are contraindicated. They lead to fetal malformations. So the other group that we are left with is NSAID. And NSAID, paracetamol, is the most widely available and safest in terms of side effects, in terms of efficacy, safety, the onset of action, everything. So if we give paracetamol, we get very good results. So the pain relief is very effective. The growth of the baby is not effective. It is reasonably priced. It is widely available. So these are some of the factors that we've been preferring paracetamol for all kinds of indications in pregnancy.
Okay, okay. I mean, someone who's a mother right now and is watching this video, should she be worried right now about having paracetamol if she's having a mild headache? Is it a point of worry?
Not at all, not at all. I don't feel she should have any kind of anxiety or any kind of worry. We have been giving paracetamol for years together. Our seniors have been giving it, their seniors have been giving it. All the standard textbooks, all the journals, all the bodies, made be the American, the English, the Indian, recommend paracetamol as the first choice of drug for pain or fever in pregnancy. So she should not be worried, but definitely she should keep her gynecologist in the loop and monitor the dose of paracetamol that she is taking. We don't recommend more than 2000 mg per day or more than 2400 mg per day in very severe cases. So may it be IV or may it be an oral preparation, she has to be very careful of how much she is taking and always keep the doctor in loop. We should not self-medicate in pregnancy.
Dr. Astik, coming to you, you're a child psychiatrist. Can you explain firstly what is autism and what are the factors that are known to influence its development, a child's development? How does it happen?
All right. So autism spectrum disorder, which is what it's called in the current literature. So it's a complex neurodevelopmental disorder that affects three basic domains, which are social domain, the communication domain, and the behavioral domain. Meaning that there should be some disturbance in the child's social, communication, and behavioral domains for them to suggest that the child has autism. The factors that are known to play a role include both genetic and environmental. So there might be genetic factors which might, there could be a genetic predisposition which might result in the child having autism later on, and there might be environmental factors, which includes prenatal, at the time of birth and later on, the factors that might influence and predispose a child to have autism. Also, there might be some neurobiological differences, meaning that there might be some sort of variations in brain structure or brain function that may lead to autism.
How do you react to Donald Trump's statement about the use of paracetamol in pregnancy, which might be linked to autism? Could you explain what observational studies show? Is there any kind of association?
So we're sticking to the issue. So the question that was being put up is whether paracetamol leads to autism. And like Dr. Manan described, I would agree with him that paracetamol, there's no conclusive evidence of any kind that says that paracetamol leads to autism. Now the question becomes, what was the mother taking the paracetamol for? Whether there's any sort of maternal infection or any sort of condition for which was which might predispose the child to autism. There are certain maternal infections or there are certain conditions which have been associated with autism, but there's no direct cause-effect relationship when it comes to paracetamol and autism, at least from whatever literature is available right now. So that would be the foremost thing. And
Okay, Dr. Asik, you've also practiced in the US, right? And Tylenol is something which is equally like consumed in a manner like if you have a fever or mild pain, headache, or whatever, then you take Tylenol. Can you tell me the consumption pattern in US and how often Americans might consume Tylenol?
So Tylenol is or acetaminophen, what it is called over there, is a over the counter is an over the counter medicine, meaning that if you are having any headache or any sort of fever or any sort of myalgia, you generally go to the store and then you pick up Tylenol as much as you need it. So sometimes there might be an uninformed sort of decision making made by the individual, not necessarily mothers. I'm not talking about that over here, but just individuals who are having some sort of symptoms. You can just go inside a store, pick up Tylenol, and as much Tylenol as you want. Although the FDA indications are given and it's labeled that you shouldn't be taking more than so and so amount of dose. But generally, the problem becomes when there's an uninformed decision. So, for example, if there's no healthcare professional who is consulted before taking the medicine, and you might take more than needed sort of dose, or you might take it more than you need to for longer duration of time. So it is usually suggested that if you're taking any over-the-counter medicine, including Tylenol, your healthcare professional should be aware of that. Besides that, when it comes to autism and paracetamol, there's no direct causation that has been found, at least in the studies that are available.
Okay, okay. Dr. Manan, can you tell me if now there is a lot of media attention around paracetamol consumption, and there have been many controversies around paracetamol in general. Could you explain what studies show about paracetamol in general, and do you think a person should take caution before having a pill?
There have been studies in which paracetamol leads to kidney damage and liver damage, but that is only on prolonged consumption. And the other thing is, a lot of fake paracetamol is available, at least in the Indian market. So I suggest all my patients to take it from a reputed brand in a reputed store. And especially in pregnancy, we are talking about a very high risk and a sensitive situation. There's a fetus and there's a mother. So, of course, try to avoid taking it as much as you can. There are many other natural methods to relieve pain. And if it has to be taken, it should be taken under a doctor's supervision. You should not be taking more than 2 to 3 tablets in a day, that too only in cases of, mild to moderate fever or high fever. And try to monitor your kidney function and liver function at least once during the course of the treatment. So the commonest side effects that we've seen are liver and kidney function damage. As far as neurodevelopmental delay or autism is concerned in children, that is something we've not seen in any of the studies till now.
Okay, okay. Given if you can share your last thoughts on this controversy and what people should know exactly. Firstly, Dr. Astik, why don't you begin?
Well, like any other medicine, the use of medicine should be guided by the medical necessity. So if there's a medical necessity that requires a medication and it is approved, and of course in consultation with your healthcare professional, then you can go ahead and take it, weighing all the risks and benefits and knowing the alternatives so that you're able to give an informed consent to take the medicine. So as long as the decision is informed, and your healthcare provider is in the loop, there's as far as paracetamol and autism goes, sometimes the media tends to be sensational, or especially what's going on right now. So just take an informed decision, keep your healthcare provider in the loop, and go ahead and take Tylenol if you need to.
Absolutely. Dr. Manan?
I absolutely agree with Dr. Astik. As soon as we write a prescription, the onus of responsibility comes on the doctor. So they are well-read, experienced professionals, and it's their daily job. So let them do their job. Don't self-medicate, especially in pregnancy. Let doctors do their job and trust them with what they are doing.
Right. Thank you so much, Dr. Astik and Dr. Manan, for joining me in this conversation and giving those informed and elaborating on this controversy and letting our viewers know what they should be doing at this point in time. first thing and the foremost thing to do is not to panic and to go to your doctors and consult them. In case there is a medication that you are taking, then let your doctors know and make sure that they are informed, because your health is in their hands. Like Dr. Manan said, as soon as they write the prescription, again, they are responsible for your health. So also take precaution when you are taking any sort of medication. Thank you so much. And thank you, viewers. If you like this conversation, don't forget to like, share, and subscribe to our channel, The Indian Express. Thank you so much for watching. Thank you so much.